Thank you for joining CCN Consumer Connect Care Network. This is Consumers Dr. Vengala. Consumer-driven healthcare. What is this? Consumer-driven healthcare. Yes, consumers get to choose their health plan. Consumers get to choose a doctor. Consumers get to choose hospital. Consumers get to choose the medications they want to buy, where they want to buy, and consumers get to finally choose what surgeries they want to undergo, and they are basically taking advantage of this. The it's already there, folks. It is just a matter of your mindset, how you achieve the consumer-driven healthcare, irrespective of whatever happens in Washington, D.C. I strongly encourage people to participate in consumer-driven healthcare fundamentals. What is consumer-driven? Basically, what I'm suggesting is, instead of buying a traditional health insurance, participate in HDHP, health disclosure, healthy pricing. The premiums are almost, I would say, 60% lower. The premiums are, you save a lot of money by being a part of the HDA. Only thing, it has a deductible portion which you have to watch out for it. You can have, basing on your capability, you can have a deductible of 1,000, 2,000, 3,000, depending on your capacity. Up to that amount, you're responsible for it. After that, you will have a coverage, insurance coverage for major medical, catastrophic illness, and lifetime maximum coverage. But up to 3,000, whatever your deductible portion is, you are responsible. So what that does is, it discourages for people to abuse the system. Basically, people have to choose the right what they need. So because they are paying from their pocket. So that is the advantage of consumer-driven healthcare. So up to certain extent, you are responsible, but on the long run, when you're in charge, you come out ahead. How do you come out ahead? I'll tell you how. Whatever the money you're saving from your health disclosure, healthy pricing, HDHP accounts, you put aside into the Health Solutions Advantage, HSA. That is a savings account, folks. You are in charge. Nobody else can. That money, whatever you contribute, every year you can contribute up to $3,500, or for a family of 4, you can go up to, actually it has gone up to $7,500, $8,500. You can check with your IRS, but you can contribute up to $8,500 every year. Can you imagine contributing for a family of 4, $8,500 every year? At the end of 10 years, you'll have almost $100,000 in your account, and it'll give you total financial independence for your family, for yourself, and you come out ahead. What I would like to see happen is, by having this Health Solutions Advantage, it has a lot of benefits. It gives you financial freedom, independence, and it's, you get to choose. That's the beauty about it. And you get to choose what you want. And by being healthy, your premiums are lower, and you're also spending less, and you're saving more. How it can be better than that? So if you have some health issues, even then you can look at your premium. You can look at year after year. You can lower your premium by participating in HDHP, health disclosure, healthy pricing, and that will give you savings to put aside for future use. Even if you have medical problems like diabetes, hypertension, and those things can be handled through HDHP, where you can come out ahead on that. this particular concept not only gives you not only gives you not only gives you financial independence, but also it gives you come out ahead in the long run. So I encourage everyone to participate in healthy disclosure, healthy pricing, along with health solutions advantage, and have an account set up at Fidelity HSA account where you can control your own money in addition to your SEP IRA, Roth IRA. And healthcare, people can make money, folks. You can save money, make money. A lot of people tend to ignore that. I believe healthcare is the one where you can come out a way ahead, especially healthcare expenses. You can come out a way ahead. So, consumer-driven healthcare, which is ultimately going to drive America and keep the cost down. That's the only way healthcare can come down, because consumer demands more competition, more transparency, more affordability. It's so critical for a consumer-driven healthcare. Affordability is number one, competition is number two, transparency is number three, and quality is number four. And our country is a private enterprise. I would like to see this private enterprise in healthcare take off, and the cost of the health care has to go down. If government can deregulate, especially hospitals and doctors are under so much pressure, they are being choked with regulations. If they give them the little bit of freedom, take away some of those I understand it's protecting the consumer, but when I compare with the food industry, folks, I don't see any difference between healthcare and food industry. When you liberalize in healthcare, especially the food industry, and you maintain the quality, and you can do both at the same time by loosening some regulations. It shouldn't be costing so much for a hospital bed. It shouldn't be hospitals are under tremendous stress because most of these hospitals are going bankrupt because they're not able to keep up with these regulations. So we need to seriously look into how we can lower the cost of the hospital. We have to have an alternative solutions like hubs to compete with subacute beds outside and lower the and have most of this surgery can be done in a hub, in an outpatient setting, and costs are a lot lower. So there are ways to do it, folks. What I'm saying is, if we can deregulate in healthcare, that will go a long way, like what we did to our airlines in 1980s, which really became so competitive. The pricing was so competitive. Right now, the hospital prices are exorbitant, and most of the Americans can't even afford it. They can't fathom, after I receive a bill for a 23-hour stay for $227,000. It's sad. How can you have that bill for 23-hour stay in a hospital for an angioplasty? 227. It's not. I think it's just impractical to run the healthcare like that. So we need to make some changes and improve the delivery of healthcare by taking away some of these strict regulations and tort reform. Those are the things we need to work on, folks. If you do like this channel, do come back And this is CCN. And subscribe to this channel, hit the notification button. I'll be keep talking about this healthcare solutions advantage, where people will come out ahead and be financially independent. Thanks again for joining. This is Consumers Doctor, Dr. Bengala. We'll see you next time.